Welcome to the podcast for the South and West Wales, and today I'm stood in the glorious Castlewoods Nature Reserve, which is in Llandilo in Carmarthenshire, and as you can hear, the birdsong is in full swing. We're definitely in springtime. There's a lot of wild garlic all around me, and it's an absolutely stunning reserve at any time of the year, but particularly in spring. And as its name suggests, there is a castle here, and yes, I think we are the only wildlife trust in Britain that owns a castle, but it's a wonderful place to come and visit, but that's not what I'm here to talk about today. I'm here with Lizzie Wilberforce, who is the conservation manager for the west of our patch, and also looks after Carmarthenshire. And today we're going to be talking about the issue of badgers, the ever prevalent issue of badgers, and the concerns around bovine TB, and the issues around culling or not to cull, vaccination or not to vaccinate. So Lizzie, welcome. If you'd like to give a bit of a context about what's happening in Wales, because we're not going down the cull route, are we, in Wales?
We're not now, no. After several proposals under different methods to go down the culling route, in the end, Welsh Government opted for a sort of vaccination programme in the southwest of Wales. So that's what's been happening for the last year or so, so it's quite a different policy to England.
Yeah, so, I mean, I hear people sort of say, well, why vaccinate? Because that's not going to get rid of the badgers with TB. So what is the point of vaccination, and why do we think it's a better route to go?
Yeah, I've always thought it's a bit disingenuous to say that it won't cure badgers with TB, because I think vaccination is quite a well understood approach, in human health terms. So we know it doesn't cure, but what it does do is prevent disease. And I think the overriding feature of a vaccination policy is that there stands no risk of making TB worse. All the debates and all the arguments and all the research that's been sort of in the public domain and that the government has funded has shown that culling, if it's not done correctly, can make matters a lot worse. But vaccination can only help, and there's not the same risk attached to it, and that's the main reason we support it.
And I mean, we don't claim that there is no interaction between badgers and cattle, do we? We do actually believe there is an interaction, but in both directions as far as passing TB backwards and forwards is concerned. Is that correct?
Yes, quite, absolutely. I mean, the disease is caused by a bacterium called Mycobacterium bovis, so it is a cattle disease in origin, but we fully understand it moves between cattle, it moves from cattle to badgers, it moves between badgers, and it moves from badgers back to cattle. So it's known that all those things occur. It's not quite so well understood the importance of the different links and the extent to which they move in those different parts of the disease cycle, but we certainly don't dispute that, and we've always said that we agree that it's a really devastating disease that affects the agricultural industry, and we want to see that addressed. It's just that we don't believe that culling would work, and we don't think that would be good for the agricultural industry any more than it would be good for badgers.
Yes, I mean, for example, I know the Independent Scientific Group did a lot of research over quite an extensive period of time, didn't they, with culling badgers in an isolated area. What did they find then when they culled the badgers?
Well, the sort of overall findings of that review, which cost millions of pounds and took about 10 years, was that culling wouldn't make a meaningful contribution to the control of the disease. They compared areas with no culling at all, and quite large study areas across the UK, and they compared those with areas where they did an intensive cull, where they took out as many badgers as they could, and then a third category where they culled in a reactive way, so only in response to TB outbreaks. They stopped that latter one because they found it made TB so much worse. So we have been hearing quite a lot about how reactive culling where you get a TB outbreak is the way to go, but that independent scientific group study showed really strongly that made matters worse for the agricultural industry. And then the findings with the more proactive cull, which is what was originally being proposed in Wales, showed that under exactly the right set of circumstances it could produce some reduction in TB. But there's legacy and sustainability issues with that, and there's still the risk that it might not work.
And I mean, with vaccination, I suppose what we're sort of saying is that by vaccinating the badgers, we're gradually weaning out the sick badgers anyway, because they'll naturally die off, and then the badgers that are left are resistant. So, like you say, there's a limited damage to be done by any potential perturbation issues of kind of badgers moving from set to set and passing on the disease to other badgers and therefore bringing the disease into other areas where it wasn't so prevalent, perhaps?
Yes, that's right. I think what's really important is that you have to remember that what you're targeting is the disease. You're not targeting cattle, you're not targeting badgers, you're targeting the disease. So what you want to do is to reduce the percentage of animals that are carrying the disease, and the only way of achieving that is vaccination. When you cull, you're targeting badgers. You're not discriminating between healthy badgers and ill badgers that are carrying the disease. And one of the results of that independent scientific group study was that although it can reduce TB overall, that's because it reduces the total number of badgers, but of the small number that inevitably remain, a higher percentage carry the disease because of the disturbance to the populations. They're going to be your founding members of your recovering badger population. So you're really going to end up worse off than you were to start with. It's not actually reducing the TB problem, it's reducing the number of badgers. So it's just the wrong approach if you want to really be serious about eradicating the disease. So
you could say actually the culling will concentrate the disease in some respects by that method.
Yeah, there's no exit strategy from it. The only way of maintaining any gain that you might achieve would be just to keep culling and culling and culling, which is wrong for financial, ethical, you name it, any number of reasons.
There's also obviously been culling of wildlife in other countries to control bovine TB and to bring the numbers of disease down. For example, in Ireland, I know that they've obviously been culling badgers for some time now, and they're saying that their TB numbers are being reduced in cattle. Now, why would that be?
TB is just to look at the wider spectrum of countries first. Actually, TB has been tackled where it's been endemic in a number of countries, and sometimes culling has been part of the solution. But that's normally been where the vector, the other secondary, the equivalent of the badger, if you like, in their scenario, has been a non-native species, like in New Zealand, where there are multiple arguments for removal of that species, including conservation arguments. So the sort of ethical context is very different to here. Badgers obviously being native and our largest remaining predator. In Ireland, one of the differences is that badger density is a lot lower in Ireland, and I think the thing that you always have to remember is that it's a fantastically, and again the independent scientific group, the randomised badger culling trial, showed how complex the disease cycle is and how complex the interactions are, and how what seemingly quite small changes to the parameters can make the difference between culling making TB a bit worse and making it better. And in Ireland, what's happened is that a similar approach has shown a very different result, and that relates to the different dynamics of the badger population and the agricultural industry in Ireland. So having spent an awful lot of time and money on huge trials here which looked at that same approach and found it wouldn't work here, that would be an enormous gamble to say, well, we're going to go with results from Ireland in a different environment just because we like the results. So I think it's the randomised badger culling trial was an enormous trial here, and we continue to be guided by their findings because they're the most relevant to our environment.
Yeah. And I mean, you touched on something there as well. I mean, obviously bovine TB doesn't just affect cattle, doesn't just affect badgers, it affects broader spectrums of wildlife in its own right. So I mean, any mammal basically can carry the disease?
A lot of animals can be affected by it, including other farmed camelids, llamas and species like that, which in the intensive action area have been tested as well. And then in wildlife reservoir, a lot of species, foxes, domestic dogs, can test positive for TB, and deer as well. Most of them are sort of end hosts for it, as in they can be susceptible to it, but not as susceptible, mostly down to the way their ecology, their life cycle. It's something about the ecology of, various elements of the ecology of a badger that make them particularly susceptible to it. But what's different about badgers is that they're more likely to pass that disease back on and to continue the cycle. So most other species, whilst they may test positive, they may be susceptible to the disease themselves. They don't pass it on in the same way that badgers do.
So there isn't the same level of interaction between farmed animals, for example, and deer or farmed animals. And
yes, and that's reflected in the fact that most deer can catch bovine TB, but it's of the deer which aren't considered a major problem, at least here. It's fallow deer which are more of a problem, and they're the ones that are more likely to interact with farm animals. So yeah, it does come down to elements of behaviour and ecology.
Okay. So coming back to the Wildlife Trust of South and West Wales, I mean, we've obviously been campaigning for a number of years about the whole issue of the culling, which was initially proposed in Wales, and now we're working very much with the Welsh Government and farmers and everybody basically to try and bring the vaccination issue to the fore. And we are looking to vaccinate now, aren't we, ourselves? We're not actually vaccinate ourselves, but be a very significant part of the programme, aren't we?
Yes, that's what we're hoping to do. Obviously, vaccination is well, in terms of what the Welsh Government have been doing, the cost is on a par with the costs that were predicted for the culling, but it is still a significant investment, and TB is a very widespread problem in Wales now. So we are hoping to support Welsh Government's currently very positive policy by trying to do some vaccination ourselves. And what we particularly want to do is look at how we can deliver that ourselves as effectively, but at a lesser cost than with with delivering some of the work ourselves and with volunteers to provide more of a financial model that's relevant to landowners wanting to vaccinate themselves, rather than having Welsh Government operatives going in as contractors and doing the whole job at a cost.
So, I mean, we're stood by a fairly large badger set here in Castlewoods. And so the proposal would be we would trap the animals in humane traps, bait and trap.
So the process that would be identical to that which has been run by the Welsh Government, which is to cage trap. So to do that takes quite a long period of time, because you need to put the traps down and pre-bait them, as it's called. So you need to put the traps down but not set them, so that animals can go in and out, and you put bait down so they get used to them, you get used to going in them, and they take the bait, and then after you've been doing that for a while, then you set the traps. And then you trap for a few nights, and in doing that, then when you've cage trapped them, obviously you're able to vaccinate them. That needs to be done someone appropriately licensed and with the right certificates, and then you can fur clip them or do something to show that you've already vaccinated that animal and release them then. There's quite a few sets in Castlewoods here that we know about, so all of that work has to be underpinned by a thorough badger sort of survey to look at where the sets are, where the active animals are, before you even start thinking about the trapping phase. So it's quite a commitment in terms of time. But as a landowner ourselves, as would most other landowners be in this position, you would have a fair idea where sets on your land were, which is why leading it as the landowner, or working as a group of landowners, gives you a good head start over coming in, Welsh Government having to come in and do all of that process from start to finish through the survey, the pre-baiting, and then the trapping and vaccinating.
Brilliant. So, I mean, we're actually looking to raise a bit of money ourselves, aren't we, to support this work, really to demonstrate actually how we can be really efficient as a country, as Wales, that in our approach to vaccinating badgers.
Yes, that's what we'd like to do. So we will, here at Castlewoods, we've got, as I mentioned, several sets that we would like to start working with, and working with partners and landowners in the area who are interested in working with us, like the National Trust, obviously here at Duneva. So there are other people in the area who own land who we would aim to work with. So it's twofold, really. I mean, we obviously, in vaccinating, we're doing that with the intention of actually having a positive impact locally on TB in the badger population. But then there is also this extra element of being a sort of demonstration project of working locally to deliver benefits. Yeah.
And I mean, we actually have to inject, well, somebody appropriate has to inject the vaccine, don't they? Because there's not currently an oral vaccine, is there?
No, oral vaccine for badgers is some years off yet, although there's a lot of research underway at the moment trying to develop that. No, at the moment it has to be injection, which is why it's, I suppose, more technically difficult and costly to deliver at the moment, and you do need somebody appropriately trained to do that bit. But again, our expectation is that we have skills that you don't need so much training for in the survey side, and things that we can contribute already with the skills that we've got. So, yeah.
And I mean, I have been asked, well, why don't we trap, test for TB, and then cull the badgers that are sick and release the badgers that are well? And why don't we? Why is that not the case?
Yeah, that's probably the most difficult part of this whole debate, is that the the logic of that is so appealing. If you're a landowner that's doing a cattle owner, a livestock owner that is doing everything right, your buildings are secure, you've got a closed herd, your boundaries are all secure, and you're still coming down with repeated breakdowns, you think, well, I've eliminated everything else, the problem's in the badgers, if I get rid of those badgers, I'll be okay. And there is just such an appealing logic to that. It's just that it doesn't work like that. Now that TB's endemic in the badgers and their ecology is complicated enough in the way they work, this issue that if you get rid of those badgers, if you remove a badger population, a set, for example, a family group, the other badgers start moving around and spread the disease. And that's what then undermines that argument. But it just is not as appealing as the logic of just get rid of the sick animals. And the same applies if you trap and then test and then cull the ones that test positive and release the others. What you're doing is that same problem. You're completely destroying the social structure by removing part of the family. You're disrupting that structure that keeps the stable family group in one location, and those animals that you release will be adequately disturbed that they will move around and disrupt other local family groups. So although that hasn't actually been tried actually as much as anything, because there's practical difficulties with this of getting a quick enough turnaround on the test, but all the modelling has shown is that would have the same negative consequences as doing reactive culling in spreading the disease.
And I think that's probably another important thing to mention, isn't it? The test is takes a long time. Any farmer knows that. It is horrendous waiting for your test results, and it's not always accurate either, is it? The skin test results anyway aren't always, it shows a positive reactor, and sometimes those cattle aren't actually TB infected, they turn out to be healthy, or vice versa.
Yeah, absolutely. And that sort of lack of specificity and sensitivity in the tests, leading to both false negatives, where you get an animal that's given the all clear that actually is harbouring the disease, and just as much a problem for farmers is the false positives, where an animal gets sent for slaughter which then turns out to be TB free. It is a major problem, because it will mean that your chances of eliminating the disease, as long as you can't be absolutely accurate in your diagnosis, is a challenge.
Brilliant. Thank you, Lizzie. And as I say, we have an appeal going to help us to really demonstrate this work in action, and to hopefully bring a sort of a sense of that we could actually manage this disease out of both wildlife and domestic cattle. It's a really promising and hopeful opportunity, and please do support us in any way you can. Thank you, Lizzie.
Cool.